Welcome. My name is Geoffrey Smith. I'm the director of the Substitute Teaching Division at Steady.org. And we have with us today as a guest presenter Ken Babcock, Director of Employees Relations from Lincoln Public School. Welcome, Ken.
Well, thank you. Glad to be here.
Great. Ken, do you mind speaking just a little louder? I think that might help when you present. Ken is I'm the one on the right, look like I'm on vacation. Ken is the distinguished looking gentleman and who looks very knowledgeable, which he is. And so we appreciate you being here and presenting this with us.
Not a problem. Is that sound better?
Yes, that does. Thank you.
Okay.
Thank you. And if anybody has a hard time hearing either one of us, please let us know in the question box and we'll monitor that as well so we can make sure that we're speaking loud enough for that. All right, in today's session, what we want to talk about is we're going to talk some research findings that Steady.org we found here just to help understand what's going on. We're also going to talk about the large employer mandates. We're going to talk about the assessable payments or the fines. We're going to talk about what is best for employees or the employer or both, what full-time measurement periods are. We're going to talk about the initial tasks that you can take as a district. What we are not going to cover, and this is probably just as important, at least what we are intending to, we are not going to give legal advice. Nothing that we have here should be construed as legal advice, just a discussion, and we hope that individuals who are participating today will ask questions and answer questions. We're going to pose it to everybody as well, and if you're doing something that you'd like to share, please put it in the comments section, the chat section, and we'll read it to everybody or as a question. So, but we do not want to any means feel like that we're trying to give legal advice. Even attorneys are having a hard time giving legal advice at this time because things are in the change. We're not going to talk about the individual mandate. You can ask questions about it, but some of these are maybe already covered previously. We might know enough about this, but we didn't want to spend some time here. We're not going to talk about the exchanges or the subsidies. In reference, we will, but we're not going to describe them, nor are we going to talk about the definition of a large employer and how to calculate that. Most everybody who's participating here today is qualified as a large employer, so that's kind of a moot issue. All right, let's go over some of the surveys that we've done and maybe give us an idea of what we're talking about. And for example, we ask a question to substitute teachers, do you currently have health insurance? And you can see 2,400 responded to this. And what was an indication is here at the very bottom with the last one, 19% said that they had no health insurance. And so we're talking about 20% of the individuals who aren't covered of those substitute teachers. Ken, is that surprising figure to you? Would you have thought that would have been different?
No, it's not surprising. For those folks, especially single folks who don't have, coverage options through their spouse, and there's a lot of young folks that are probably rolling the dice.
Yeah, I would have thought. I guess in my opinion, that would have been higher. I would have expected that more individuals wouldn't have health insurance in the current pools right now. We ask also, does your school district offer insurance at your level of employment, meaning the number of hours you're working? And so 91% of the respondents said that there was no health insurance offered to them because of the number of hours that they were working or the positions that they were in. Another question, if your district offers insurance, would you take advantage of it? And 43% said that they would, and it would be very helpful, which is an indication also of those who need to have access to it. 41% said they didn't need it, and only 5% said that they would want to purchase it somewhere else. So those are on your handouts if you want to take a look at those further. But let's talk about, let's go right into the large employer mandate and the hurdle. Ken, why did you call it a hurdle?
I just thought it was appropriate. It was a good analogy in this race. We have several hurdles. And if you wish, you wish for me to speak about
Please.
these?
Yes, please.
Okay. There are two major portions of the regulation, and with two major fines. Now, they don't call them fines. They call them shared assessments or something like that, but I call them fines. The first one, the first fine, the first hurdle is very, very important in that you must offer minimum essential coverage to 95% of your full-time employees and their dependents. Now, I underlined offer there because you don't have to have 95% of them take the insurance, but you must offer it to them, or you pay fines. And this is, and I'll talk about that in a minute, but this is a huge fine. This is what I call, some people call this the sledgehammer fine. I call it the death penalty fine. In this, and you, once again, you offer minimum essential coverage to full-time employees in their dependents. Spouses are not counted as dependents, and I don't understand that, but that's how the regulation is written. So if you were to offer single coverage and offer employee plus children, you've met this portion of it, that you've offered coverage to those folks. Once again, they don't have to take it, but you have to offer it.
I see. Good.
So the next question is, okay, what's full-time? And that's one of the things that everybody's grappling with, is that according to the regulation in the law, a full-time employee is 30 plus hours per week or 130 hours per month. And, you know, we had some school attorneys doing somersaults and saying, hey, we can do this because we take 30 hours per week and we multiply that times 52 weeks in a year. You know, we've got a whole lot of employees that don't work that criteria. So then but the regulations, they thought about sneaky educational people thinking of this. So they said that educational employees, we're going to look at them differently. They say, okay, full-time educational employees, you could use a couple different ways. One of them is if they work 1,059 hours or more in a year, they're full-time. The other way is to say, okay, do they average 30 hours per week for all non-break periods during the school year? And then, so then the question is, well, what is a break? Is this if, you know, if you're off one day in honor of Martin Luther King Day in a week, do you count that as a week? And they say, well, okay, breaks less than 4 weeks long are included in this calculation. And I think that this is the one that most school districts will use because it's to your advantage generally. Because if we're looking at substitute teachers, for example, if you look at in a given year, how many weeks can they work? And you can actually count weeks that are in your Christmas break or your spring break, as long as those breaks are less than 4 weeks long. So what you do is you're spreading out your year. And LPS's part, when we do that, we look at, okay, from the first day that the substitutes could work to the last day substitutes could work, we count all of those weeks, and there's 41 of those, and then we multiply that by 30. So our criteria is 1,230 hours. So do they work 1,230 hours in that year? And you can see that's considerably higher than the other safe harbor right above it at 1,059 hours. You also, they say in the reg that if someone is scheduled or could work one day in a week, then you can count that if it's the beginning or the last week of the year. So, for example, on the first week that a teacher or a sub could work is on a Friday, you get to count that whole week. And if the last day they can work is on a Monday, you get to count that whole week. But there is a clause also in the regulation, and then it's my words, not the Fed's words, is don't mess with us on this, because they understood that there would be people who would try to gerrymander this a little bit and extend their year out a little further than it should be. But, you know, ours at LPS, we figure our calendars out a couple years in advance, and we've been right around 41 weeks for the last few years. So we're using 41 weeks times 30 hours, and that's our threshold. Also, in order to offer coverage, an annual open enrollment must take place. Now, we've got a lot of questions about, okay, does that mean next fall do we have to have an open enrollment? And that question is unanswered at this point, because the employer mandate was pushed back until 1/1/15, but we don't know if we get transitional relief then until the renewal or the plan year after 1/1/15. In most school districts, or many school districts, their plan year starts on 9/1. So we don't know if these mandates will be effective exactly on 1/1/15 or 9/1/15. So
Interesting.
right.
So right now you have that 41 weeks is been your standard, and you'll keep that as your standard, for example, and then keep the 1,230 hours.
Yes.
Now, what do you see might happen during the springtime when subs are needed more? Are you monitoring it now? What are you doing now?
Oh, yes. We started at the beginning of the school year. We started monitoring that, and actually, what we did last summer is we did a look back, or an unofficial look back, and what we found is that we had a handful of people that would have bingoed up as full time. Most of those folks were not just pure substitutes, that's all they did for us. What we found out, where our greatest jeopardy lies, is in those employees who do many jobs for us. Many times they are a substitute, but then they also may coach for us, they may take tickets, you know. If they're not subbing, they may be a mentor, or they may be a substitute para also for us. And they work lots of different jobs. So what we did is our information services folks, they put together a program over the summer that will combine all of those jobs. And we can, and this year we're just monitoring. We're not limiting hours. We're just monitoring to see what our possible liability will be.
And you're monitoring it with your automated system?
Yes.
Yeah.
Yes.
Okay.
We have a time and attendance system, and when substitutes sub for us, and we have it well documented how many hours they're supposed to be there, and so every day they do that. I believe it's 7.5 hours, and if it's a half day, it's 4 hours. But then they go in and they approve that later, so that throws all of those hours into the system. And then if they take tickets for us at night, it throws that hours into the system. So we get a total hours, not what that was our problem before. We could pull it out of this system for their substitute, and we could pull it out of this system for taking tickets, but we didn't have a program that put it all together, and our information services people put that program together. So that will be very helpful.
I see. You know, so questions come in is, if you're using 41 weeks multiplied by 300 or 30 hours, that equals 1,230 hours per year. Where does the 1,059 hours come from?
The 1,059 hours is a safe harbor within the legislation. They say that you could use either one of those two methodologies. there is actually the verbiage in there is in my mind somewhat convoluted, but if you do the calculation, you get to the 1,059 hours. So between those two, for LPS, and I think for most districts, the second safe harbor of the average of 30 hours per week times the number of weeks, you want to get that threshold as high as you can. So the 1,059 is within the regulation.
I see. Another question's come in. We pay our subs on a daily rate, but heard we should convert to an hourly so that only the 7 hours per day count, not 8 hours per day. Is that advisable, Mr. Attorney Ken?
Well, I always say if your attorney tells you to do this, then do it. Our attorney, because we have in our substitute handbook and so on and so forth, it's very clear what a day is, what the expectation is, and he said that would be sufficient, and it's 7.5 hours, and then they just clock in that they were there for a full day or a half day. But I fully understand where some will say, because within the regulation that says, okay, if you don't have accurate hours collected, then the default is 8 hours per day. And so I can fully understand where an attorney would give that advice. Clock them in per hour, then for sure you have accurate hours. And I always tell people is whoever's going, if you have an audit or if you have a problem with PACA, whoever in a federal official comes to your school or your district, whoever is sitting beside you during that audit, that's who you want to take advice from. So if that attorney is going to be the one during an audit, that's whose advice you want to take.
Good. All right. Very good. Let's talk about the fine. That's not a fine.
Okay. Yes, it's a fine. It's a fine that's not a fine. But this is, and this is why I call this is the death penalty fine in my verbiage. That's not in the reg. But if you fail to offer insurance to at least 95% of your employees, and just one employee goes to the exchange and is able to get a subsidy because on there it said, were you offered insurance? And he says no, he or she says no. Then the fine is $2,000 for each full-time employee less 30. Now, and that's in the regulation, the less 30. Now, that less 30 really matters in my example coming up here where you got 100 people, or 100 full-time employees. With LPS with 5,000 employees, that less 30 really doesn't help us much. But in this example, let's say that we have 100 full-time employees, minimum essential coverage is offered, is not offered to 10 of them for whatever reason, be it oversight. So they are at 90%. They're offering it to 90%. So one of those full-time employees goes through the exchange and gets a subsidy because they weren't offered coverage through work. Their fine is the 100 full-time employees minus 30, because that's in the reg, times $2,000. So the fine is $140,000. Now, ironically, in my mind, that if that district did not offer any coverage to any of its employees, the fine would be exactly the same, because it doesn't. If you're at 90% or 0%, the fine is the same. Which is, I saw on a previous slide that, and I was glad to see that, where it was pay and or play, because I think that in this situation, you know, this this employer can say, hey, I'm offering coverage to 90% of my people and probably paying a huge bill for that. But now I also have to pay the fine. I consider that doing both playing and paying. And LPS's part, we're between 25 and $30 million that we pay for our portion of health insurance for our employees. So we're in that 25 to $30 million that we're already paying. Our fine would be approximately $10 million. So we would be paying the $25, $26 million to Blue Cross Blue Shield, plus another $10 million if we mess this up. So I always tell people that if in a school district our size, if there's a $10 million fine, somebody's going to lose their job, probably be me. So it is a sledgehammer.
So with you're paying now between 25 and 30 million. If you decided not to offer any health benefits whatsoever, you would still pay the fine of 10 million. So you would drop from 30 million to 10 million.
That's correct. Yes.
Yeah. You might not have any employees, but
right.
Okay.
But
All right.
that's across the country, that's what employers are grappling with. What is the best for their organization?
Yeah. Okay. So with this fine, regardless how many employees you have, the regulation said you can deduct the first 30 employees and not count them in.
That is correct.
So that's why the minus 30. It's just the first 30 employees you can deduct from the calculations and then just pay the fine on the remaining.
Yeah.
Okay.
And as I said, for smaller districts, that could, if you've got, for example, 60 full-time employees, by subtracting the first 30, you cut your fine in half, But if you've got 5,000 employees, the minus 30 doesn't even count hardly.
Right. All right. This leads us to what does it mean by offering health insurance? Okay.
Yeah. And minimum essential coverage, it says that you must offer minimum essential coverage. And I would guess that all school districts offer minimum essential coverage. The group plan must pay at least 60% of the total allowed costs, which means on a huge group, if you look at your deductible and coinsurance, and there's calculators that will do this to say, okay, on an average, will it pay 60% of the total allowed cost? I think probably most school districts are, probably in that 80%. So that's not a problem. Your carrier can compute that for you, or HHS has a calculator for it. But I don't see any school districts getting tripped on offering minimum essential coverage. The second one, now we're okay. Just to back up a little bit, we're past the big fine. We've offered insurance to 95% of our full-time employees. So we breathe a sigh of relief, and we go on to the next two hurdles. The next two hurdles are that you have to have minimum essential coverage. That's a low hurdle. We can get over that. And then the next one is the big one for a lot of folks, is it must be affordable. And affordability is measured as if the employee's portion of the employee's contribution towards the health insurance is less than 9.5% of that employee's income. And it's based, and this was a break for all employers, is the affordability test is based upon the employee's district earnings, okay, because you don't know, the employee could have 2 or 3 other jobs. You don't know that. And the cost of the district's single health insurance coverage. It's not the family, because if it was, if it would make this a lot harder if the employee's portion for family insurance couldn't be over 9.5% of that income. Then there'd be a lot lot of school districts, including LPS, that would have some difficulty with it. But if all they're looking at is the employees' earnings at the district and the cost of single coverage, which makes it much more easy to deal with. But and long range, just kind of thinking outside the box here, what that does in negotiations, and I know many of us don't negotiate with our subs, but we negotiate with other employee groups, is that from the district's eyes, it's really important when we're negotiating to keep up the contribution to the single coverage, right? Because it doesn't matter what the district contribution is, for the family coverage. It's based upon, okay, if this person took single coverage, what would be the district's contribution? So I can see over the years that if money gets tight, that those contribution levels, they'll remain the same or maybe be bumped up for the single, but the district contribution levels for the other tiers may go down in the future.
Good. All right. Well, that makes sense. So those are hurdle 2 and 3. Once you get past the major hurdle number 1, which is getting fired if you're not met, right?
Right. Yeah.
And this one, these penalties are not quite as severe as
right.
that initial.
These aren't as bad. In the next slide, let's see here.
We're going to go to safe harbor.
And because then the next question is, okay, if it's 9.5% of the employee's salary, how do we measure his salary? Well, they give us 3 different ways. One of them is the W-2. I think it's box 1 on the W-2. You can look at that and see what that salary is. We'll have some accountants that will say, well, that's not really the salary, because there are some funds that decrease that box. I think maybe a medical flex, if you have medical flex, that W-2 that comes out of that box, and we want that. We want the rate of pay to be the highest, because then the 9.5% of that is higher. But I'm thinking that many of us will use that, and it's easy. It's real easy because you have the W-2 information. The other way is another way of doing is the rate of pay, and they say you can take the hourly salary of someone, multiply it by 130 hours, and okay, that for that month is how much you base. That's his salary. That's what you say that salary is. Well, if they're working more than 130 hours, then that actually decreases what the actual pay is. So I don't know if that'll be used a lot. The federal poverty line, I would say nobody's going to use that, because federal poverty line is very low. What they say you can do is just assume that the employee is at the federal poverty line. And that really decreases. I think all of our employees that we're paying that are full time, they're above the federal poverty line. So I would suggest that once we get to looking at this, that probably most people will use the W-2, the box 1 on the W-2, to figure out what the salary is.
Great. Let's talk a little bit about the fines.
Okay. Now the fines, they're a little less onerous because it is based upon per employee so if there's an employee who doesn't buy your insurance because it is unaffordable, in other words, it's over 9.5% of his salary to pay for the single, and goes to the exchange and gets coverage and gets a subsidy, he gets a subsidy through the exchange because what you offer to him is unaffordable, then that fine is $3,000 per employee receiving the subsidy. Now you can see the $3,000 is, of course, higher than the $2,000 in the sledgehammer penalty, but the 3,000 is per employee receiving subsidy, so it's not per all of your employees, which was the first fine, the sledgehammer, the death penalty fine. So this is some people call the first one the sledgehammer, and this one called the tack hammer, because it's just $3,000 per employee receiving a subsidy. So it should be much less, but they do cap it at the $2,000 per FTE minus the first 30. So they cap it at the death penalty, which is nice of them.
Yeah.
But if you get hit with a few of these 3,000s, that's not nearly as bad as the sledgehammer penalty of the 2,000 per full-time employee.
Okay.
And then I have an example here of if a district has 500 full-time employees, and it offers coverage. So we're past that at Part A fine, right? The offering to 95%. But we have 100 full-time, and the district is contributing $3,500 per year per employee. And of those 500, there's 100 of those that when you do the calculation, the employee's part makes the insurance unaffordable. Well, those 100 full-time employees, they go to the exchange, they receive a subsidy because it's unaffordable through the work. Their fine is $3,000 times those 100 employees, which is $300,000. Now, that will be offset, though, by anybody who is actually switching from the district coverage to the exchange. Because a lot of those folks, I do it somewhat tongue-in-cheek, is they didn't know it was unaffordable. They were actually taking the coverage before, right? And you were paying, or the district was paying, $3,500 towards their coverage. Well, once PACA came in, they found out that was unaffordable. Now they switched to the exchange. Now they get theirs to the exchange. Now it costs you $3,000 for that person, where it was costing you $3,500 before. So you could have, in that situation, you would have a $500 net decrease in cost for that one employee. The one that costs you in this scenario, would cost you, is the person that you were offering it at $3,500 per year, and they didn't take the insurance, hadn't taken the insurance for a long time, and now goes to the exchange, and now you have a fine of $3,000. Well, that's new money that you hadn't paid out before. So it's and that shows you somewhat the magnitude of this legislation, is that when I'm explaining this to my board members, I kind of get excited about just a $3,000 fine, which is bad news, but that we can handle some of those as opposed to a $10 million fine.
Right. All right. Here's another. Let's do an example. Another example.
Okay. And I used to teach math, but even this kind of gives me a headache because of all of the numbers. But in this example, we have a full-time employee that is earning $25,000 a year, and we have a $500 single premium, and the district splits it 250 and 250. Okay, and this is probably not unusual for a lot of classified staff members. The employee is put in $250 a year, or excuse me, $250 a month. So that's $3,000 in a year. So if we do the contribution to the salary ratio, right? That's 3,000 divided by 25,000. So he is paying 12% towards his single health insurance. So that's not affordable, right?
Because
It's got to be.
it's greater than 9.5%.
That's correct. So I just worked backwards then to be affordable. I took 9.5% of the $25,000, and that's $2,375 per year, or $197.92 per month. That's how much he could pay. Now, one way to do this would be to adjust, right, the district's payment up to decrease the employee's payment down to the $197 per month. That'd be one way to do it. Another way to do it is if you have an option to offer a lower coverage, and I say a bronze-like coverage. Bronze-like is bronze is a name they use in the exchange for a 60% actual value, which is minimum essential coverage. So if you could drop your coverage down to a 60% one, and we in Nebraska, we have this opportunity to do this, and then that brings the premium down to $400 a month, which then makes the employee's portion of $190. The district could pay $210, and the employee can pay $190. Now it's affordable for him. It's not as good as coverage, but it's affordable. And in what we have the opportunity here in Nebraska is we can offer a dual option. We can say, okay, you can take that $500 one that I talked about up above, and that's like a $750 deductible. Or on an individual basis, you can opt to this bronze-like coverage. Well, the regulation says when you're looking at affordability, you look at the least expensive option that offers minimum essential coverage. So if you offer two options, you compute affordability on the cheapest option. So you can really help the district in that case by saying, okay, well, yeah, we now offer this more affordable option, and under this option, now it is affordable. Thus, the person cannot go through the exchange, they can't get a subsidy, and the district cannot get the $3,000 fine.
Very good. So if most districts right now are offering an 80-20 or a 70-30, if you offered those plus a 60-40, for example, a bronze level like coverage,
yes,
then you're complying with the law.
Well, what you do is then you compute your affordability on the bronze-like coverage, which is cheaper, which really makes it much more affordable to many more people.
I see. Good. Okay. This, when I put this slide together from your slides, Ken, I put everything together so we could talk about if there's any questions about the bronze, silver, and gold questions, the actuarial value, the family size for the federal poverty level for one individual is 11,000. And that's why you were saying 9.5% of 11,000 is what they would pay. So no, that wouldn't be even though that is a safe harbor, that's probably not going to be used.
Yeah, because I would guarantee, well, not guarantee, I would say that almost everybody that's full time, 30 hours or more, is making more than $11,000 in a year. But this slide is just full of information, but the upper left talks about the various levels. If you go into the exchange, they're divided into actual aerial value levels, and there's kind of like Medicare supplements. If you've ever helped your folks go through and get a Medicare sup, they go from bronze to platinum, depending, and platinum is the best. Then on the bottom left, if you're able to go through the exchange, if you're not offered coverage, or if the coverage you're offered at your employer is not affordable, and you go into the exchange, then you're able to receive subsidies. And the subsidies are, in my opinion, very liberal, in that you can get a subsidy and still earn up to 4 times the federal poverty level. And the bottom left just is a very short table which shows, for example, a family size of 1, the federal poverty level is $11,490. Well, you can get a subsidy, and if you're able to go through the exchange, and make close to $46,000 for a family of 1. So, and if we did not offer insurance through the district, all of our first-year teachers with a BA would be able to get a subsidy through the exchange, because our base salary is less than $46,000. Then on a family of 4, the federal poverty level is $23,550. On a 4 times the federal poverty level is a little over $94,000. So it's very liberal in being able to obtain a subsidy if you're able to go through the exchange and able to get a subsidy, because it's not offered through your employer, or it's unaffordable through your employer,
or you don't qualify for it.
Right. If I go in, for example, affordable coverage is offered to me through the district. If I go in and apply, I can get coverage through the exchange, but I cannot get a subsidy through the exchange, because the first criteria is it's offered through my work and it's affordable, so I can't get it, period. In fact, if we look long range, as I'm the negotiator for the school district, I think long range that in the future, because the subsidies are so liberal, if you can get one through the exchange, I would foresee that some of our employee groups may come to us, some of those with lower salary employee groups may come to us and say, we would like you to drop our health insurance, because if you drop our health insurance, we can go through the exchange and we can get such a better deal through the exchange than what we're getting through you. At that point, our initial answer will have to be no, because that could drop us down below the 95%. And then we'd also have to do an analysis. If we get below the 95%, that's for the whole district, and there's no disallowance in there for collective bargaining units. So we'd have to look at that very carefully.
Which is interesting. This brings us to the next several slides where we, what is best for the employee, what is best for the district, or what is best for both under the
Right.
law. What we're talking about is under the way the current law is written.
Yes, and on this slide, on the right-hand side, this is, and if you could just back up just a second there to the previous slide.
Okay, it's coming.
Okay. Yeah, thank you. On the right-hand side is if you go in and you're eligible, let's say that you're unemployed or you're self-employed and you don't have access through insurance through your employer. Let's say you're a substitute, right? And you don't have access. and what they do is they figure out, okay, where are you in the percentage of the federal poverty level, and then they set your premium based upon your income. So it really doesn't have anything to do with the cost of the premium. Your part of that premium cost is based upon your income level, and you can see that it goes up as the more the more money you make, that criteria goes up. And but if you're at 300 to 400% the federal poverty level, the most you're going to pay for your insurance is 9.5% of your income, period. Right? Now, and this is one of those cliffs within the law. If you're at 401% of the federal poverty level, you're going to pay the full amount of the premium. Okay? But it's estimated that 64% of the population are within 400% of the federal poverty level. So the vast majority, almost 2/3 of the people, if we don't offer them coverage, they will get a subsidy if they go through the exchange.
Okay.
In this case, what I did is I did sort of piggybacked on that last example about the person was making $25,000 a year, and we were able to go with the bronze-like coverage. His part is $190 a month. Okay. Now, if he is single, and we're just going to pretend now that he is has no affordable coverages offered, okay? If we said, nah, we're not even going to pay anything towards it, you go to the exchange. Now, remember, we can't do that with more than 5% of our people, because then we get that sledgehammer penalty. But just looking at this as an individual, if he was single and there was no affordable coverage offered, he would get Silver Plus coverage, because there's within the exchange, if you go in there, you get a subsidy, of course, and we've talked about the subsidy, but you also, if you're within 250% of the federal poverty level, they actually you don't get silver coverage. You get, which is 70% actual value. They actually decrease your deductible and co-insurance a little bit. So just saying that, okay, he would, if he went through the exchange with his income on single, he would pay he would pay $144 a month for bronze, or excuse me, for silver, and $95 a month for bronze coverage. So think about this. We offer him affordable coverage up on the top. It's bronze-like coverage. He's going to pay $190 a month for that. Okay, and we're clear though, because we've offered him coverage and it's offered him affordable coverage. If we had not offered him coverage, he could go through the exchange. He could get bronze-like coverage that's going to cost him $190 for the per month. But because of the subsidies, it will cost him $95 a month through the exchange if we had not offered him coverage. If he has a non-working wife, then of course that changes the federal poverty level, because now it's two people instead of one person. But if he has a non-working wife, and I assume that for employee plus spouse, it's $800 for our coverage. Through the district, he's going to have to pay $590, right? Because we won't support anything past single. So most likely he's not going to take the coverage at $590 per month. It's still affordable because all affordability is based upon single. But if he wants to cover his wife, it'll cost him $590 a month. And then the next slide show
It's coming.
that if we did not offer him any coverage and he was able to go through the exchange, now with he has two people in his family, he would be able to get a silver plus coverage, an 87% actual value, and it would cost him $94 a month, and compared to the $590 in the previous slide.
Mm-hmm.
And if he wanted bronze coverage, which is what we're offering him, it would cost him nothing.
Wow.
Okay, so if he understands the exchange, that he may come to you and say, don't offer me coverage, right? Don't offer me coverage, because if I want to cover my spouse under these rules, it'll cost me $590. I can go to the exchange, it'll cost me $0, right? So there will be a conundrum when that hits.
Yep.
So,
okay, what about the employer? What's best for the employer?
Okay. In this case, this same situation, we may spend, but if we offer the affordable coverage, we may spend the $25.20 per year, our part, $210 a month times 12. But if we do that, we protect ourselves from that possible $3,000 fine if he goes, because by offering it and offering it affordable, we protect ourselves from the fine. If we by not offering affordable coverage, that we know we'll spend $0 for health insurance, but we may be liable for the $3,000 fine, because we're assuming that the fine only happens if the employee goes to the exchange actually and he applies for it, and if he applies for it, he will get the subsidy. So it's most likely we'll get that $3,000 fine. So when I look at this, it appears that the employee needing insurance will be much more likely to purchase the insurance through the exchange in scenario 2. It appears that the greatest liability for the district will happen if we don't offer the coverage, right? Because if we offer the coverage up above, it may be that he still may not take it, right? He still may not take it in scenario 1. It's much more likely to take it in scenario 2, where he could get, if he's got a spouse, he can get $0. He get coverage for him and his spouse for nothing. So it's much more likely we will get the fine then in scenario 2. So I'm just looking at those two, and it appears that it's best for the district to offer the coverage.
Okay. What about what's it best for both?
Well, and this is actually still a continuation
with the employer.
What's best for the employer, and it's ironic that I think it appears best to offer the insurance for 3 different reasons, and the first one is the ironic one, is that PR-wise, it just looks better if you're saying, well, we are offering affordable coverage, and that's the headline in the paper, right? Even though, and it appears in a headline that the district is helping its employees, where in fact it might be best for the employees if the district did not offer the insurance. It's fairly likely that the employee will not take the district insurance, especially if they've been running without insurance for a while. I know there's an individual mandate, but the mandate fines are so small I don't think that's the mandate's not going to push him into insurance. And then it protects us from the $3,000 fine, and it protects the district from the negative public relations of being fined $3,000 for not offering affordable coverage to its employees.
Okay.
And then the next one is what may be best for both. Okay, and this is on a couple slides, but
we're down to about 5 more minutes, Ken. Sorry, we're down to about 5 more minutes. Sorry.
Okay. Okay. Well, I can do this. The assumption is that the employee salary is within 4 times the federal poverty level. I should have added another assumption here. The assumption is too that this decision to offer coverage or not won't put us in jeopardy of that death penalty fine. Okay, so the employee salary is within 4 times federal poverty level, which is about 2/3 of the people. The employee does not have access to inexpensive coverage to the spouse's work. Okay, the hours are close to PACA full-time status. Okay, so it's right around that 30 hours a week. And the assumption is that we can control the hours worked. And I think that is a true assumption. Okay, what looks best for the employee in the district in that scenario, those ones that are very close to 30 hours, it appears that the best thing is to control the hours so the employee is not full-time, right? Then the employee can receive the exchange subsidy, and the district is not liable for any fine because the fines are all built around full-time employees. So what we've done is we've controlled the hours. Now remember, the assumption is they're close to full-time. So they're in that 28 to 32 hours, in that range, right? Mm-hmm. They're not a 40-hour person. But this is, I think, those tweeners, those ones that are close, that this might be best for both.
Good. So, and that's a possibility. Now, what we've talked about here is what the law is and what we need to be looking at as school district or large employers, and staffing agencies face the same with this with employees who are close to full-time. And they have to address this as well. Some of the areas of concern that we need to look at are the part-time variable employees, these right close to full-time, substitute teachers, coaches, and others who are, and some that we've never tracked time for before, because that is a big deal with the number of hours they're putting in, your coaches and multi-sports coaches, for example, that might be put in close to that. We need to monitor those. And how we do that, that's a big question. We have had questions, and a lot of people are interested in how they're doing that. What we've heard, and Ken, if you've heard of what districts are doing, they're looking at especially with those with automated systems, or can track that a little easier than without that. But they are getting reports, and so they can see what they're looking at. This year, with the mandate pushed off a year, we can take a look at this year and seeing what the situation is before some actually limit hours. Some are actually limiting hours now, and to see what the impact of that. Long-term substitute teachers, those individuals who maybe take a long-term assignment at the beginning of the year, become qualified for health insurance, become designated as full-time employees, but they might only work 3 months, and then the rest of the year they may not work at all. But yet, because they've become and qualified as full-time, designated as full-time for the year, then the insurance must be paid. But if they're not receiving a paycheck, what do you do with their portion of the premium? How do you collect that? And so that's going to be an issue that we have to address. Any comments on any of these, Ken, so far?
Well, on tracking, you talked about tracking, and the next bullet too is that we have a time and attendance system. Our coaches who coach only for us, or they're substitute and they coach, we still pay coaches via a stipend. we are having them track their hours on paper, and then the office personnel are entering them into our time and attendance system, so then it can be included in the total number of hours when we're seeing if they meet full-time status.
Right. Good. And one of the areas of concern is the effect on the students. What is this going to have? And that's where we're really interested. Is everything that we do is helps the substitute teacher be successful in the classroom and have a good experience with the students when the permanent teacher needs to be out of the classroom. So we're watching this very closely. That's one reason we get involved in these webinars is because it affects what's happening in the classroom. And so as a district and those of us who employ substitutes, we need to make sure that we keep the learning continued while the permanent teacher needs to be out of the classroom. With a measurement period, we have a minimum of 3 months up to 12 months. And you mentioned that you're going to use 12 months. Is that correct?
Yes, our attorney suggested 12 months. So we started ours July 1 of last July 1 for the initial measurement period.
So the July 1, 2013 to June 30th, 2014.
Yes, yes. Because if we have an open enrollment, it will occur in August for September 1. So we have that administrative period up to 90 days in between where we can distinguish, okay, who was full-time, who wasn't, and those that are full-time, we can notify them that they're eligible for open enrollment and give them the instructions how to get on the website and apply for health insurance.
Great.
And then the stability period, it can't be any shorter than the measurement period, so it'll be a year long for us. So once one of these variable hour employees, they show up during our measurement period as being full-time, we offer them insurance, then we do that for 12 months, which is problematic because you said that, substitute teachers, their hours can vary so much during the school year. So what do you do during that stability period? They're on insurance and their check doesn't cover, they don't substitute for a month. So there is supposed to be payroll deduction for their part, and there is no payroll. So payroll will probably have to go out and ask them for that money.
Okay. We've listed here some things to do. Any comments on any of these you want to talk about?
No, I think we've pretty well touched on them.
All right.
Yeah.
Okay, we have talked about most of these on these pages here. There is the budgetary planning, to pay for your advisors and attorneys' fees that you have come up. Advisors could be your provider for healthcare. They're very knowledgeable and they've come up to speed quite a bit with this, and they're dealing with other large employers, and so it would be very helpful to consult with them as a provider.
Yes, and then there's some big time consulting firms, national consulting firms that are out. They'll sell a service, so many $1,000s, per year. They'll come in, they'll audit all of your stuff, and they'll work with you and the board and so on and so forth. So far, we've decided not to do that. We've just, we're paying attorneys and so on when we need opinions, but it's whatever you're comfortable with.
Mm-hmm. Good. All right. Again, we have the options are pay and play, as well as, or both, which would be the worst situation. Limiting hours is an option, and outsourcing to staffing agencies or others is an option. Independent contractors, if substitutes are independent contractors, that would be an option. More information. Here are some links that you can go to for more information on that, on what we've talked about here today. We also will be having this some more information on the substitute teacher shortage. Part of the Affordable Care Act and limiting hours is causing this. Others districts are finding that they're actually not hiring as many as they have in the past, and more teachers, more out of their pool are becoming employed as permanent teachers, and so there's a shortage. About 48% of the districts now are experiencing shortages of substitutes. We'll be hosting a webinar on January 14th at 1 p.m. Eastern Time, just like this, and you're more than welcome to register for that and participate in that. SubSolutions Conference, our National SubSolutions Conference, we host every year. This year it'll be July 9th through the 11th in Park City, Utah. And I think we're going to be spending a lot of time, particularly discussion table time, on those districts who start to measure it and how easy it's been, what they're going to give their experiences on what it's been like. You will have done it for a year, for example, by July 9th, and we'll have a number of districts that will be talking about how they're doing it and others who will be wanting to know. And so we'll be spending quite a bit of time at the conference talking about both the shortage of substitute teachers and what districts are doing to bringing their numbers back up, as well as how do you handle non-certified subs, then as well as the Affordable Care Act. So these are things that are coming up. We'll be spending quite a bit of time on those. Uh, why, as I mentioned earlier, why steady.org is involved in this. And we always want to watch what is happening with substitute teachers and how we can help district personnel responsible for substitute teaching know what to do and to help their substitute teachers. Steady.org does offer college level and research-based training for substitutes, particularly focused on non-certified substitute teachers, both its initial and ongoing. And as we do limit hours, you'll have to bring on more substitute teachers. We want to make sure that they're well trained, they've got college level and research-based training in order to teach, in order to manage a classroom based on principles, as well as the effectively implementing lesson plans left by the permanent teacher. So we want to make sure that that happens as well. I know we're over a little bit, and we apologize. There are some good questions, and hopefully we've answered all of them either during the presentation, and you're more than welcome to email us if you have additional questions and comments. And Ken, really appreciate your time today and your expertise and your knowledge. You really are one of the best in the country with this. I think at first you ask a lot of attorneys, and I understand a lot of attorneys are asking you now about your understanding of the Affordable Care Act as it relates to substitute teachers. I think you've spent a lot of time and effort in this arena. We really appreciate you taking the time today to be with us on this.
Well, thank you. I enjoyed it. Thank you.
All right. Thank you all, and we appreciate you joining with us on this webinar. Goodbye now.